Hi, my name is Jordan Teitelbaum. I'm a board-certified fellowship-trained otolaryngologist ENT specialist with subspecialty training in rhinology, which is the advanced study of sinus disorders. I'm here today to talk about rhinitis, which is an extremely common condition that patients come to ENT for, but also they see their primary care. Rhinitis is a nasal cavity inflammation disorder. The nose is reacting to either things in the environment or other triggers, which causes swelling and inflammation, and then symptoms. The most common symptoms are nasal congestion, stuffiness, runny nose, or postnasal drip, which is a very common thing patients come to see me for. We typically divide rhinitis into either the allergic type or the non-allergic type. The allergic type is often easier to diagnose and understand what's happening. Patients with allergic rhinitis, they'll have itching, they'll have runniness, they will often have seasonal variation, or they will get symptoms from certain triggers such as pollen, mold, cat or dog dander, or even dust mites if it's an indoor allergy. Non-allergic rhinitis can sometimes be a little bit harder to identify, but it's very, very common. Patients also get congestion, and they typically get a lot of runny nose. This can happen with weather changes, temperature changes, not necessarily seasonal changes. It also happens a lot to patients with extreme cold or when they're eating or with hormonal changes. It can even be a consequence of taking certain medications which cause runny nose as a minor side effect. Figuring out what type of rhinitis you have is often the best first step to figuring out what treatment options would be best for you. Treatments include things like nasal saline mist, nasal saline irrigations, medicated nasal sprays, avoidance strategies, allergy testing, or allergy shots. If your rhinitis goes along with things like deviated septum, nasal obstruction, or even chronic sinusitis, it might be an option to do imaging or even minimally invasive procedures. Getting a good diagnosis and a handle on what symptoms bother you the most and what type of rhinitis you might have is the first best thing you can do to figure out how to treat it. To learn more about rhinitis and other associated conditions, please visit enthealth.org or talk to your local ENT specialist about what you're feeling.